Hello guys and welcome. Today I want to talk about 10 quick clinical tips for medical students that I want you guys to be aware of. They're just common sense stuff, but I think it's important. And the thing about clinical school is you really never know what's up until someone tells you and then just brings you consciously to some particular things that will be very important otherwise. So I want you to pay attention. Number 6 is actually probably my favorite. Just pay attention and watch out. So 10 quick clinical tips for medical students. This is more especially helpful if you're in clinical school, right? Now, number one that I want you to be aware of is there's hierarchy in medicine, right? Don't answer questions that are not for you. So answering questions, right? Answering questions. Now, most of the times in medical school, if you're a clinical student on ward rounds, right? You will have your consultants are going to ask questions, right? They're going to ask questions about, many things. But like you have to be careful when you're answering questions. When a question, and sometimes you're going to be in clinical rotation with other students in other classes, right? So when the question is not for you, or when the question has passed your class, let's say for example you're in fourth year and they're asking fifth year medical students some questions, please do not try to answer it. If they ask your year and you don't have the answer or you cannot answer it, please do not try to answer questions that have gone above your grade. If you do, you have put your seniors in jeopardy, you have embarrassed them, and then you've put the whole profession, as they used to say, in jeopardy. So just don't answer questions that are above your year. Number 2, now this is more this is more practical. Bring a hand sanitizer when you are coming for clinical rotation. Bring a hand sanitizer. The beds in the hospital, the door knobs, the everything you're going to be touching in the hospital is likely contaminated. The worst form of infections are hospital-acquired infections. You don't want to be there, trust me. So bring a hand sanitizer every time you are coming for clinical rotation. Number 3, third tip I'm going to tell you about is when you're examining your patients as a medical student, your eyes are not as trained as experienced clinicians. Please take your time, expose the patient adequately, of course, right? Expose the patient, right, adequately. But the thing about adequate exposure is you also have to mind the dignity of the patient. This is more importantly because you need to look for pedal edema. Sometimes you come to the bedside and then the patient is lying down on the bed and then has covered themselves. They've covered themselves from neck all the way to toe. How would you know if the patient has pedal edema? So expose properly. Look at the legs, look at their feet, just expose that quickly. There are a lot that you're going to see when you want to expose that. Why exposing? Let me just tell you some things to look out for. Look at their legs. Look by the side of the bed. There might be a urethral catheter in situ. There might be an IV fluid, there might be a drip stand with an IV fluid. So check out for urethral catheters or catheters generally. Check out for drains. Check out for drip stands, right? Drip stands. And then, look under the bed. What does the patient have under the bed? Is put some morgue. Look at the bedside of the patient. Look at the cupboard of the patient. What do they have, right? In fact, one clinician once told me that by looking at the bedside of the patient, if you are dealing with patients that pay out of pocket, you can know the quality of, you can have an idea. You can't know for sure, but you can have an idea if the patient can afford branded medications and stuff, so that you can have an inclination into the socioeconomic status of the patient and know how to prescribe so that the patient will be able to afford what you have. But you can only do this if you really look. Number 4, I told you number 6 is a particularly interesting tip, right? Number 4, right? Bring your basic tools. Guys, see, what they used to say about the farmer does not bring a hoe. Bring your stethoscope. There is almost no clinical rotation that you're not going to need a stethoscope, right? So bring your stethoscope. Another important thing you should bring around. So for example, you're in internal medicine, you're doing neurology, or you're doing neurosurgery, please bring your pen torch, right? So bring your pen torch. Now you're doing obstetrics and gynecology. It's very important. Now you might not think about it, but it's important that you bring a measuring tape. Alright, so you bring a measuring tape, right? So your O&G rotation. Why? Because you will have to check for symphysis height and stuff like that. And if you don't have it, you start explaining and you don't have so much evidence to defend yourself. If you are doing, as I said earlier, if you are doing neurology or you are doing whatever postings you are doing, but for example, bring a patella hammer if you are going for a neurology posting. It's important that you bring a patella hammer. There are other things like maybe a tongue depressor and other minor things you're going to bring, maybe a cotton wool to check for reflexes, color wheel, Ishara chart, and all this kind of thing, depending on the postings. But these basic ones, you should have them when you are going for some of your clinical postings, especially your stethoscope and your pen touch. Some neurologists will send you out of their ward rounds if you don't have a pen touch. How are you going to check for pupillary reflex? How can you know if the brainstem of the patient is intact? How can you know the patient is dead if you don't have a stethoscope or a pen touch? And of course, not many. I wouldn't want to share my stethoscope with you in the first place for clinical rotation. Right? So that's something important you should, bring around. Now, number 5. If you're going for clinical rotations, I strongly suggest that you bring analog wristwatches, right? Or timepiece, whatever timepiece you have. Now, when you bring an analog timepiece to your clinical rotation, what it helps you to now these days, other clinical staff, so you are going to get the vital signs of the patients ready already. You know the blood pressure, the pulse rate, and all that. But if you are in cardiology, for example, or if you want to just be a careful doctor or a careful person, right, you might need to count the pulse rate yourself. You're counting the pulse rate not just because you want to know the rates, which you are going to have the number, right, but you want to know the rhythm, you want to know the volume of the pulse, you want to know regularity and stuff like that. Best way you're able to know all that is if you actually have an analog wristwatch to guide you, because there's the touch effect that you have all the vitals, you're not touching the patient for any reason. You don't need to be touching the patient at all times, but when you want to check, for example, for pulse, it's important that you have your watch where you can count so that you can know exactly what the pulse rate of the patient is. Now, if you are getting gifts, you can as well get, or if you are requesting for gifts or you are giving other clinicians gifts, I think you should give them analog wristwatches that have second hands on their face. Now, number 6, I think this is the most important tip I'm going to probably be giving you guys today. When you're going for your PSY posting, that's your psychiatry posting, your psycho posting, or your behavioral science posting, as they used to say, right? There are things to avoid, guys. There are things to avoid. Number 1, now I should tell you, statistically speaking, most PSY patients are not violent. However, it's important that you don't bring ties. For the male medical students, don't use ties. Don't use your tie, right? Your necktie. Do not use your tie when you're coming for PSY postings. Every clinician will also tell you this as well. Also, use plain coats. If you're going to use word coats, use plain word coats. The reason why you need to use plain word coats is because you don't want word coats that have ropes or accessories at the back, so that it's not dangerous. All right. When you're going for PSY postings, whenever you're interacting with PSY patients, usually there are 2 doors. All right, there are 2 doors in the consulting room or the examining room. There has to be 2 doors so that one gives you a room for escape if you really need to escape. You want to be safe at all times. So this is a safety tip. You just have to be aware of it when you're doing your PSY postings. But I mean, you get to pick these things up either ways, but it's good to know them beforehand as a medical student. Number 7 tip I'm going to be telling you is just a tiny detail when you are doing wound examination. Right? So you are doing wound examination. For example, you're in plastic surgery and you are doing wound examinations. Your necktie, right? Your necktie. Either you bring a bow tie, you don't bring a tie at all when you're in your plastic surgery rotation, or you have a tie clip so that when you bow or you bend to take a close look at the feet of the patient to examine their wound, for example, your tie does not touch the wound or fall on patient or fall on the beddings or stuff like that. Some microbiologists did a clinical research where he was culturing the ties of medical doctors, the necktie, and he found out that there are more dangerous organisms on the necktie of doctors than on the nose of dogs. So that tells you how contaminated your ties are when you bring them. So especially when you are doing wound examinations, you want to use a tie clip so that your tie does not get contaminated. Number 9, when you are, and this is another subtle examination tip that you need to be aware of, when you are eliciting cough reflex. So for example, you are doing an abdominal exam, and there's a video on abdominal exam in my channel, so you can look for it and watch it, or maybe I'll drop the link somewhere here where the red pen is, right? So when you are doing an abdominal exam and you want to elicit a cough reflex, tell the patient to face the other side, right? So typically you are standing on the right hand side of the patient, right? talked about that when we're talking about videos on examination. So you're standing on the right hand side of the patient. However, when you want to elicit cough reflex, you tell the patient to look on the other side so that when he coughs, you don't get everything that the patient is having poured on your face and then you inhale it immediately. Don't forget, someone said there was a research that said sneezing and coughing, that bacteria and the particles that are the aerosols that are expelled by the patient move at 60 kilometers per hour. So as long as the patient has sneezed or coughed, you have already inhaled it. It's given, because 60 kilometers per hour, that's a lot of distance covered in a short period of time. So you can't even hold your breath to that. All right. So tell the patient to face the other side when you want to elicit cough. Also, another subtle tip when you are doing a chest examination, especially for females. All right. So when you are doing the chest examination, say you want to examine the middle and the lower lung, zones in the female. As a whatever you are as a clinician, traditional clinicians will tell you that you don't use the palm of your hand to touch on the breast of female patients. So you use the back of your hand. So of course your examining hands will be gloved at that point. So you can put the dosum of your hand underneath the breast, and then you can gently lift it away from the chest wall, and then you can auscultate using your stethoscope. It's just a subtle clinical skill. It makes you professional, makes the patient comfortable, and then makes you an overall polite clinician when you're examining your patient. The next thing we're going to talk about is, don't forget, use the dosum, right? Dosum of your palms. Right? The next and the last tip we're going to be talking about is when you're leaving the hospital. As a medical person, when you're leaving the hospital, the last thing you want to do is wash your hands, take off your ward coat, and most importantly, when you are doing laundry for your stuff, make sure when you're doing laundry for your work clothes or your school clothes, make sure you use antiseptics when you are doing laundry for your clinical stuff, your ward coat and stuff like that. Make sure you use antiseptics when you are doing laundry for them. So let me just take you once again. I said earlier, just a summary. When you're answering questions, when the questions is above your class or above your year or grade, don't attempt it. Even if you know it. I know it's difficult because you are brilliant and you know Crabgrass syndrome. But if your seniors don't know Crabgrass syndrome, have it in the back of your mind and just swallow it for the meantime, for respect, for courtesy, and for hierarchy's sake. Always bring your hand sanitizer when you're coming for your ward rounds. The doorknobs, everything in the hospital is contaminated. Assume that, and then you'll be a safer person and a healthier doctor. And I mean, your health is wealth. Who will guard the guards? Physician, heal thyself. So expose your patient adequately. Look for urethral catheters by the bedside, underneath the bed. Look for drip stands. Look for drains. And so that you can, and then look at the cupboard of the patient so that you can have an overall idea who this patient really is. Always bring your stethoscope. Bring your pen, touch, measuring tape, particular hammers and stuff when you're going for clinical rotations. Analog wristwatch are better so that you can count pulse rates, breath sounds, and abdominal bowel sounds, and time them. It's better that way. When you're going for PSI or psychiatry or behavioral clinic postings, don't use neckties, use plain word codes. Always examine a patient in a room that has 2 doors. Very important. Now, when you're doing a wound exam, take off your ties, put your ties in between your shirt, or don't bring a tie at all. When you want to, when you're doing an abdominal exam and you want to elicit a cough reflex, tell the patient to look the other side. Very, very important. When you are doing the breast exam, use only the dosum of your palm to maneuver your way around the breast and then auscultate the chest wall. When you leave the hospital, make sure you wash your hands, use antiseptic. Please, this is the first time in a long time I'm doing a paper-faced video. If you like the style of this video, if it's clear enough, please leave it in the comment section below so that I'll know if we're going to continue more teaching videos using this particular style of lectures. Thank you very much, and don't forget to like and subscribe to this channel. Once again, my name is Dr. Piro, your invincible clinical guide through medical school. Bye.